Hello, you guys. Here is our question of the day presented by Apex Nursing Academy. A client with myocardial infarction, or MI, suddenly becomes tachycardic, shows signs of air hunger, and begins coughing frothy pink sputum. Which finding will the nurse anticipate when auscultating the client's breath sounds? Now, anybody that knows Apex knows the number one test taking strategy is to repeat the question before you drop down to make an answer choice. You want to repeat the question, then go right into recognizing cues and analyzing cues. As you read, pick up the significant data. So I've gone ahead and highlighted your significant data. We're talking about a client with myocardial infarction, tachycardic, air hunger, coughing, frothy, pink sputum. These are some signs and symptoms, right? I also highlighted suddenly because that's giving us a time frame. This suddenly happened. Which finding will the nurse anticipate when auscultating breath sounds? So we're talking about auscultating some breath sounds. We have some signs and symptoms: tachycardic, air hunger, coughing, frothy pink sputum, and it's telling us that this client has had a MI. So that's our significant data, and we go right into analyzing our cues, which is just linking the cues to the context. What does this mean? What are we talking about? What is the subject matter? What are they asking us about? Myocardial infarction, or MI, is commonly called heart attack, but it really is just sudden lack of oxygen to the heart tissue. This can cause damage to the muscle, the heart muscle. If you have this damage, that can affect the pumping action and the O2 supply. If circulation isn't happening well, blood isn't flowing well, it's not delivering that oxygen to the tissue. So that tissue is lacking oxygen there. Tachycardic just means heart rate greater than 100 beats per minute. Air hunger is basically saying short of breath, you're not getting enough air. Frothy pink sputum. I know we've talked about this before, but frothy pink sputum, you want to associate that with pulmonary edema. Breath sounds. Recall your breath sounds, especially for pulmonary edema, since we've analyzed our cues. Frothy pink sputum, we've linked that with pulmonary edema. Recall breath sounds for pulmonary edema. Remember, too much fluid is backing up into the lungs, and you begin to hear these crackle breath sounds, right? So we've recognized our cues, we've analyzed our cues, we can start reviewing and eliminating answer choices. Put all your cues together in the context and then go to your answer choices and start eliminating. So the first choice was stridor. And if you recall your breath sounds, stridor is narrowing airway. That is what causes that stridor sound. Crackles can be fine, of course, but crackles, we associate that with the fluid buildup. Ronchi is like a continuous gurgling, snoring sound. It's really not associated with pulmonary edema, so we knock that out. And then diminished breath sounds are weak, muffled, shallow breathing. So you really just want to lean on your nursing knowledge here with your breath sounds, associating pulmonary edema with crackles, right? Which crackles is going to be the correct answer. Um, and we just got that because we pulled from our data. We pulled from our significant data in the question. What really cued us in was it's happened suddenly. The frothy pink sputum was a huge cue because we know that it's linked with pulmonary edema. And when you have pulmonary edema, you're going to have that fluid backing up, fluid buildup, and you're going to hear crackles for your breath sounds. So that is what leads you to the correct answer. Focus on your subject matter, focus on breath sounds, recall your nursing knowledge, and pick the right answer. Remember, use your cognitive skills and happy studying. We'll see you on our next question. Bye bye.